Good afternoon, everybody. Firstly, thank you to the organisers of the prize for shortlisting our submission and giving me the opportunity to talk about ALSPAC, the data we've collected during the pandemic and how we've been documenting it in a way that supports both open science and team science. So my name's Kate Northstone. I'm an associate professor in epidemiology based in the medical school. I'm also one of the 4 members of the ALSPAC executive who run the study, and I've got responsibility for all things related to data. I really want to stress at this point that I'm purely the spokesperson here and represent a much larger team who have really done the work that I'll be talking about today. So for those of you who are not aware of the study or who need a reminder, ALSPAC stands for the Avon Longitudinal Study of Parents and Children. It's a birth cohort that enrolled pregnant women who were living in and around Bristol, with due dates falling between the 1st of April 91 and the 31st of December 1992. The study is known locally and also to our participants as Children of the 90s, and we're currently core-funded by the University, the MRC and Wellcome. The 14,000 children who were born into the study are now turning 30, and we followed them and their parents, and in many cases now their own children, ever since. We've collected a vast amount of data since the study began, and that data has become an accessible resource for the research community and is open to all. The number of access requests continues to increase over time. Over the last 5 years, we've received on average 20 requests per month to access our data, which includes 100,000 variables in our main resource, primarily collected via questionnaires and face-to-face clinics. But we also have a wide variety of other data types available, as listed here. As you can imagine, curating all of this data is quite a task, and we had already adopted the use of data notes to help us with that process. Indeed, we've been committed to being as open and transparent with our data and its description for a long time before the pandemic hit. So when it did hit 2 years ago, we recognised that the measurement of this type of population-based event is exactly what ALSPAC was set up to record. As an epidemiological study, we had a duty to document as best we could the events of the pandemic and the impact it had on our participants. This has resulted in 6 separate questionnaires sent out with data provided to date by more than 9,000 participants. We've also undertaken 2 sets of antibody tests and linked to Public Health England pillar testing information, with more data to come. The study has never seen this frequency and depth of data collection before and is unlikely to again. As part of the COVID-19 National Core Studies Longitudinal Health and Wellbeing Programme, we've collaborated closely with several other longitudinal population studies which required rapid processing of our data. Tying this with the fact that we were reporting results to SAGE almost weekly via HDR UK at the height of the pandemic, we knew we needed a different way of recording and reporting our data, which is where our data notes come in. And to date, we've published 8 on Wellcome Open Research describing our pandemic-related data. Prior to the pandemic, Professor Nick Timpson, the principal investigator of the study, had already established a gateway on Wellcome Open Research. Given the speed with which data was collected and made available, we were able to lean on this as a vehicle to get information about our pandemic data into the public domain quickly. So what is Wellcome Open Research? Well, in a nutshell, it's a platform that enables rapid publication of open access articles. Articles are published online in a matter of days after submission, and they all undergo a completely transparent peer review process, with the publisher working closely with the authors to identify appropriately qualified independent reviewers. The platform also facilitates publication of articles beyond the standard academic research paper. So on this slide, we can see a snapshot of the ALSPAC Gateway on the platform. This simply provides a portal through which all our publications are accessible and located in one place. This includes data notes and the more traditional academic papers. And here you can see 2 of our COVID data notes. The first one has undergone full peer review as denoted by the 2 green ticks. As soon as those ticks are obtained, the article is pushed out to PubMed, which, as we know, is the usual point at which an article becomes discoverable. The second data note, as you can see here, has been considered by 3 reviewers. One's happy with it, but the other 2 are awaiting their responses to our rebuttal. Until we get those 2 green ticks, the article is not fully published, but it was immediately available online shortly after submission and is free to access in a way similar to preprints. So what exactly do we mean by a data note? Well, it's an opportunity to clearly describe a scientific data set. This is pretty flexible in that the data set could be a whole sweep of data collection at a particular time point, or it could be a description of variables collected at multiple time points, but on a particular topic, for example. So by doing this, we can promote both the discovery and the use of research data. A data note enables us to describe why and how data were collected and created, including details of derived variables and the code that was written to create them. details that are often overlooked in research papers. We can describe any limitations or other nuances of the data and provide details on where and how to access it. And for me personally, probably the biggest benefit of a data note is being able to directly name the people who contributed to the collection and processing of that data, rather than just the academic staff taking most of the credit as they do in standard research papers. Finally, multiple versions are supported. So to summarise the benefits of publishing data notes, we've been able to facilitate rapid discovery of our pandemic data. We're providing key references and aligned data sets for researchers for years to come. This process has afforded a different way of thinking about how we describe our data beyond our usual data dictionaries. They force a more detailed description of what was done, why, when, and how. We've been able to describe the nuances of the data in detail and also offer suggestions to researchers as to how they might want to use the data. We can also update the data notes as we go, should we make any changes or additions to any data sets. Finally, as previously mentioned, professional services staff who are so often overlooked as authors are included and therefore appropriately acknowledged for their work. Looking to the future, we as a study have some important things to think about. Do we continue to pursue data notes for all our data collection activities? And if we do, what do we do about the 100,000 variables and the other data collections that already exist? Each data note is still a significant amount of work, and it'll be nigh on impossible to fund that kind of work retrospectively. But on a broader level, the idea of peer reviewing the data production process, not just how it's used in research, is interesting and thought-provoking. Another issue is that Wellcome Open Research is an excellent vehicle for the data that's been collected through Wellcome funded research, and it's currently not the only platform. But how do we encourage more funders to support and more publishers to recognise the value of data notes or similar articles? Finally, I just wanted to highlight again the importance of the staff who contribute to data processing, and I therefore believe data notes are an excellent channel for valuing and supporting team science. So the ALSPAC work has been very much a team effort, and I want to take the opportunity to thank them for all they've done over the past 2 years. Thank you, of course, to our participants, our funders, and also thank you very much to you for listening. I look forward to answering any questions you might have.